Hello dear friends, I Dr. Shamsher Singh welcome you all to my YouTube channel Pharma Learning. Today I am going to discuss with you about next GPAT series which will be very useful for you to appear in the GPAT exam. So we will start about the GPAT questions. The first question for the GPAT series is adenosine is preferred in the termination of supraventricular tachycardia because the options for this question are it is endogenous, short acting, prevent vasodilation, potent vasodilator, or inhibits sympathetic system. So you should choose the correct answer for this question very fast. The correct answer for this question is short acting because this adenosine, which is a type of precursor for the ATP synthesis, immediately provide ATP for a short time, and it is useful to terminate supraventricular tachycardia, which can be associated with mild myocardial infarction. So you are welcome to Pharma Learning channel, and the next question for this series is the drug which cause slate grey bluish discoloration is. The options are lidocaine, verapamil, amiodarone, and sotalol. So very firstly you should choose the correct answer and you can comment in the box. The correct answer for this question is amiodarone because this amiodarone drug which contain a iodine component, and due to the presence of iodine in the structure of amiodarone, it provides slate grayish blue discolorization to the skin as well as to the other body parts. So the next questions for the GPAT series is which of the following drug is contraindicated in Wall-Parkinson-White syndrome? The options for this question are nifedipine, amiodarone, verapamil, and diltiazem. So you should choose the correct answer for this question. The correct answer for this question is verapamil. Verapamil is contraindicated in Wall-Parkinson-White syndrome because it interferes with the refractory period, and also this verapamil can interfere with the preload on the heart side. So the conduction velocity can be variable with verapamil. That's why it is contraindicated in Wall-Parkinson-White syndrome. Now the next question for this GPAT series on Pharma Learning channel is calcium channel blockers are contraindicated in. Options are heart failure, ventricular arrhythmia, hypertension, and angina. So you should choose the correct answer for this question. The correct answer for this question is heart failure. Now you can easily assume that the calcium channel blocker in case of heart failure can progress the heart failure. The reason is the calcium channel blocker also interfere with the preload and little bit interfere with the afterload. So continue use of calcium channel blocker will reduce the turnover of the blood toward the heart side, and they are not being a preferable agent for the heart failure patients. Next question for this series is which of the following endogenous mediator can be used for supraventricular tachycardia? The question is which of the following endogenous mediator can be used for supraventricular tachycardia? The options are adenosine, anandamide, opioid peptides, and adrenaline. So you should choose the correct answer for this question. The correct answer for this question is adenosine. So adenosine is a useful in a supraventricular tachycardia where there is a increase in the ventricular contraction, and this ATP will be useful to recombat and to maintain this ventricular tachycardia by providing energy source. So the next question for this GPAT series is, acute ventricular tachycardia is treated by, the options are digoxin, lidocaine, verapamil, and amiodarone. So you should choose the correct answer for this question. The correct option for this question is lidocaine. So acute tachycardia can be treated by lidocaine, and you know that lidocaine is a sodium channel blocker. Now it weakly block the sodium channel, and use of lidocaine in acute ventricular tachycardia, not chronic. If the question will be chronic, this will not be the option for lidocaine. So lidocaine is useful for acute ventricular tachycardia, which can be associated with myocardial infarction. So if there will be a question that the acute ventricular tachycardia associated with myocardial infarction can be treated by, the answer will be lidocaine. So you are welcome to Pharma Learning channel, and the next question for this series is, choose the wrong combination of disorder and a drug of choice. The options are congestive heart failure digoxin, Wolff Parkinson White syndrome amiodarone, type 2 hypercholesteremia statins, supraventricular tachycardia phenytoin. So you choose the correct answer and you can comment in the box. The correct answer option for this question is supraventricular tachycardia cannot be treated with phenytoin. This is a wrong combination. You know that phenytoin, which is a sodium channel blocker, is preferable anti-epileptic agent, and use in case of epilepsy would not be useful for the supraventricular tachycardia. Now the next question for this series in the Pharma Learning channel is, select the drug that is indicated for cardiogenic shock from the following list. So you will be having options: dobutamine, sotalol, amiodarone, and amlodipine. So you can choose the correct answer for this question. The correct answer for this question is dobutamine. So dobutamine is indicated for the cardiogenic shock in case of patients, but if you will having a option of dopamine, then dopamine is not more effective than dobutamine. So because dopamine increase the aortic wall contraction, so that means it independently will be responsible to increase the workload on the heart side. So if you will be having option between dobutamine and dopamine, dobutamine is better as compared to dopamine. So this is a correct answer for this question in a cardiogenic shock. So the next question for this Pharma Learning channel is, the important site, the important effect of natriuretic peptides in heart failure is, the options are increasing, increasing sodium excretion in the kidney, release of aldosterone, release of antidiuretic hormone, and release of endothelin. You can choose the correct answer for this question. The correct answer option for this question is increase sodium excretion in the kidney. So natriuretic mean natri indicates sodium. Natriuresis mean excessive sodium excretion from the kidney side, and these type of peptides are used in heart failure. The next option question for this GPAT series is, One of the following drug that is indicated for ulcerative colitis is, the options are sulfamethoxazole, sulfadiazine, mefenide, and sulfasalazine. You can choose the correct answer for this option. The correct answer for this option is sulfasalazine. So, sulfasalazine is a drug used for the ulcerative colitis, but here this is a compound from the sulfonamide category. And suppose if you will be having a option in between sulfasalazine and mesalazine, like mesalazine, so this mesalazine will be a better acting ulcerative colitis agent as compared to sulfasalazine. So sulfasalazine in between these option is a correct answer. The next question for the GPAT series is, D-amphetamine has most prominent. The options are beta 1 effect, beta 2 effect, metabolic effects, CNS excitatory effects. You can choose the correct answer for the D-amphetamine, which is a amphetamine, dextro type amphetamine, D isomer of amphetamine. The correct answer is CNS excitatory agent. So you know that amphetamine increase the level of glutamate in the CNS, and by excessive glutamate release, amphetamine act as a excitatory agent in the CNS. So this is a correct option for this question. You are welcome to Pharma Learning channel. And the next question for this GPAT series is, phenylephrine has most prominent. The option for this question are alpha 1 effect, beta 1 effects, beta 2 effects, and metabolic effects. So you can choose the correct option for this question. The correct option for this question is alpha 1 effect. So phenylephrine, which you know it is used in many of the cough syrup, and it is used for the treatment of pulmonary congestion. So it is beneficial and it is effective through the alpha 1 receptor. Alpha 1 receptors are present in the bronchi and pulmonary system. So phenylephrine is a correct, this alpha 1 is a correct option for the phenylephrine. So the next question for the GPAT series is, vitamin K promotes the hepatic biosynthesis of following blood clotting factors. The option for this question are factor 1, factor 2, factor 8, all of the above. You can choose the correct answer, that how vitamin K promote biosynthesis of these factor. The correct option for this question is factor 2. So vitamin K intake will promote the biosynthesis of factor 2 in our body, and it is a correct option for this question. The next question for this series is, following mediators are involved in acute inflammation except. The options are histamine, leukotrienes, interferons, and bradykinins. You can choose the correct option for this question for the acute inflammation. The correct option for this question is interferons, because interferons are not a mediator for the acute inflammation, they are a mediator for the chronic inflammation. The reason behind is interferon activation increase the release of T cell mediated immune response in our body, and it is the later stage whenever the patient will suffer from the little bit subacute or chronic type of inflammation. So interferons are the correct answer for this question. The next question for this series is, The most important dose limiting adverse effect of colchicine is sedation, next kidney damage, diarrhea, and muscle paralysis. Now choose the correct option answer for this question. The correct answer is diarrhea, because colchicine is a drug of choice at the initial stage in gout, and suppose within 72 hours if we found a patient suffering from gout, we prefer a colchicine as a first choice drug in a gout, and continued use of colchicine at a higher dose can cause liver failure, and this is a major side effect, which is a diarrhea by using the colchicine. The next option for this question GPAT series is, the next question is, earliest sign of aspirin toxicity is, the options are tinnitus, metabolic acidosis, Ray syndrome, and respiratory depression. You can choose the correct option for this question. The correct answer for this question is tinnitus. So this tinnitus will only occur with aspirin if you will use aspirin at more than 1.2 gram or a 2 gram of dose. And this is basically seen in old patients where you know that due to some ototoxicity and due to some toxicity with auditory nerve, this aspirin or interfere with the movement of the fluid in the air. This aspirin causes tinnitus in the patients. The next question for this GPAT series is, which of the following is directly acting vascular smooth muscle relaxant? The option for this questions are verapamil, minoxidil, clonidine, dioxide. You can choose the correct answer, correct option for this question. The correct answer for this question is verapamil is a directly acting vascular smooth muscle relaxant, because this verapamil is used as a vascular smooth muscle relaxant. Verapamil directly causes relaxation of the smooth muscle. That's why verapamil is preferred in case of hypertension, and it lower the preload over the heart, and it is reported that verapamil improve the ejection fraction from the heart side. So that's why verapamil is the correct option for this. The next question for the GPAT series in the Pharma learning channel is, the most potent stimulant for heart is, options are adrenaline, noradrenaline, dopamine, and ephedrine. You can choose the correct answer for this question. The correct answer for this question is adrenaline, because adrenaline directly increase the heart rate, but it is a negative inotropic agent. So if option will be which one is a negative inotropic agent, the negative inotropic agent is adrenaline. The reason is adrenaline can increase the heart rate, but it also increase the oxygen demand of the heart. That's why adrenaline is a negative inotropic agent for the in other options, in other questions. So the next question for this GPAT series is, in hypertension, which drug besides lowering blood pressure arrests and even reverse cardiac hypertrophy? The options are ACE inhibitors, beta blockers, calcium channel blockers, and diuretics. You can choose the correct answer for this question. The correct answer is ACE inhibitors are the agent which also lower the blood pressure and even reverse the cardiac hypertrophy. That's why the ACE inhibitors are the preferable agent as antihypertensive and as well as in cardiac hypertrophy associated with acute myocardial infarction. So that's why ACE inhibitor directly reduce the preload and afterload, and ACE inhibitor improve the ejection fraction of the heart. So this is the correct option for this question. The next and last question for this series is, which of the following will result from blockage of H2 receptor? The option for this question are: decrease CAMP in the cardiac muscle, increase CAMP in the cardiac muscle, decrease IP3 in the gastric mucosa, and increase IP3 in the gastric mucosa. You can choose the correct answer for this question. The correct answer is decrease CAMP in the cardiac muscle. So H2 receptor blockage reduce CAMP level because they act through this particularly GS type of GPCR. So if you will block this receptor, they will decrease the CAMP level in the cardiac muscle and cannot be useful in case of cardiac problem. So these were the following questions of GPAT series I have discussed with you, and you are welcome to Pharma Learning channel, and you should like, subscribe and watch these all videos, and in the coming time I will show you and share with you more videos with basic concept that will be useful for the GPAT. You are welcome. Thank you very much.